You know, when we think of surgery, we picture this calm, controlled environment. But what we don't see is the absolute biological storm that erupts inside the patient's body. It's this incredibly powerful, ancient survival mechanism that, honestly, we're just now really figuring out how to manage. So let's dive right in and unpack the surgical stress response.
So, what really happens in that split second? That first incision, it's not just a cut, it's a signal. It's a profound shock to the system that kicks off this massive cascade of changes, all designed to help the body survive. And that is the surgical stress response.
At its heart, the surgical stress response is the body's all-out attempt to keep things stable, to maintain what we call homeostasis. It's trying to heal, fight off bugs, and redirect energy for repairs. But here's the catch. If that response is too strong for too long, the very thing designed to save us can actually start causing some serious harm.
Okay, so here's our game plan for this explainer. We're going to look at how the body first reacts. Then we'll dive into the hormonal and immune systems. We'll touch on what happens when things go wrong. And then, and this is the important part, we'll talk about how we as anesthetists can step in and control that storm using our drugs and modern strategies like ERAS.
All right, let's start with the 30,000-foot view. How does the body actually respond to surgery? Well, it's not just one thing. It's really two huge, interconnected systems that leap into action at the same time.
And here are our two players. You've got the neuroendocrine metabolic response, that's all about nerves and hormones, and then you have the inflammatory immune response, which is your cellular reaction. The best way to think about it? It's like the body's central command system, working hand in glove with its troops on the ground.
So let's dig into that central command first, the neurohormonal cascade. This is the body's lightning-fast messaging service. It's the first domino to fall, and it happens the instant tissue is injured.
Now, I know this diagram looks a bit intense, but the idea is actually super simple. Just follow the signal from the incision. It's basically a pain signal that shoots up the nerve, through the spinal cord, and hits the brain's master controller, the hypothalamus. And that one single activation point, that's what sets off the entire body-wide hormonal storm.
So once the hypothalamus gets the message, it flips two major switches. First is the SAM axis. This is your classic fight or flight response, an instant dump of adrenaline that gets your heart racing. Then you've got the HPA axis. This one's more of a slow burn. It's a sustained response that leads to the release of the famous stress hormone, cortisol.
And this chart just shows the fallout beautifully. The hypothalamus is basically an orchestra conductor here. It cues the cortisol and adrenaline, but it also ramps up hormones like ADH and kicks off the RAS system to hold on to water and salt. Ever wonder why your post-op patient isn't making much urine? This is why. The body is literally battening down the hatches.
Okay, so we've covered the hormonal messengers from central command. Let's switch gears now and talk about the troops on the ground, the immune and inflammatory storm. This is happening at the exact same time, and it's every bit as important.
When tissue is damaged by surgery, it's like a bugle call for the entire immune system. First on the scene is the innate system. Think of them as the non-specific first responders. They start cleaning up the mess and call for backup. And that backup is the adaptive immune system, the specialists like T cells and B cells who mount a much more targeted attack. Now, the way these immune cells talk to each other is with these little chemical messengers called cytokines. You've got the pro-inflammatory ones that basically scream, "Sound the alarm," and bring more troops in. But to keep things from getting out of hand, the body also sends out anti-inflammatory cytokines to say, okay, control the response. It's this constant, delicate tug of war.
And this right here is a really critical concept, especially for your exams. The stress of surgery, especially with all that cortisol floating around, literally tips the scales of our immune system. It shifts towards a Th2 or anti-inflammatory state. Now that helps prevent excessive tissue damage, but it also temporarily weakens our ability to fight infection. Clinically, this is exactly why a major operation can put a patient at a much higher risk for a post-op infection like pneumonia. Their defenses are just down. So this is all a beautifully designed survival mechanism. But what happens when it goes into overdrive? Well, that's when the very thing meant to protect us becomes the problem, leading to some pretty severe consequences. When that inflammatory response just goes wild and becomes systemic, you get what's called SARS, and you absolutely need to know these clinical criteria. The heart rate jumps over 90, the temperature is either too high or too low, the breathing gets fast, and the white cell count goes haywire. If this isn't controlled, SARS can snowball into multi-organ failure, or MOF, and that is a life-threatening emergency. Okay, so this is where we, the anesthetists, come in. This is our moment. Our job isn't just to make sure the patient is asleep. It's to be the conductor of this whole orchestra,
to actively step in and blunt this overwhelming stress response with our skills and our drugs.
One of the biggest daily choices we make is whether to use intravenous anesthetic like propofol or inhaled anesthetics, gas, and they have really different effects. Volatiles are fantastic at suppressing that HPA axis and knocking down cortisol. But propofol seems to be better at inhibiting the sympathetic nervous system and has some really interesting anti-inflammatory effects. It also tends to preserve the function of our natural killer cells, which, let me tell you, is a huge topic of discussion in cancer surgery right now.
But of course, our toolkit is way bigger than that. Opioids can help, but they might also be immunosuppressive. Drugs like dexmedetomidine and lidocaine have some great anti-inflammatory properties. But honestly, the real heavy hitter, the game changer, is regional anesthesia. Putting in an epidural or a nerve block is like cutting the wire. You stop that initial stress signal from ever reaching the brain in the first place, which just powerfully shuts down the whole cascade.
But controlling the stress response isn't just about what we do in the operating room anymore. The modern philosophy is this huge, holistic strategy called enhanced recovery after surgery, or ERAS. It's a total game changer.
ERAS is the whole journey. It starts way before surgery, getting patients stronger, giving them carbohydrate drinks so they don't show up depleted. Then, during surgery, we focus on things like minimally invasive techniques and regional blocks. And after surgery, the focus is on getting patients up, moving, and eating right away. Every single step is meticulously designed to minimize physiological stress.
And that quote really nails the goal. Everything we do, from the drug we choose to telling a patient it's time for a short walk, is about modulating the stress response. See, we're not trying to eliminate it completely. You need some of it to heal. We're just trying to keep it in that perfect Goldilocks zone, where it helps recovery without causing harm.
So this leaves us with a pretty big question for the future. As we get better with things like robotic surgery, the initial injury gets smaller and smaller. So how do our strategies need to change? Do we need to focus more on psychological stress, or maybe on fine-tuning the immune system even more precisely? It's a fascinating challenge for the next generation of anesthetists.
All the information we've covered today is based on some fantastic, high-yield review articles from top journals. If you want to go deeper on this topic, I'd really recommend checking them out. Thanks so much for tuning in.